When we think about one of the most important operating levers, it really is managing the total cost of care. Today's cost of care models are fundamentally limited. They often miss the interconnected drivers of medical and pharmacy trend that impacts affordability. When we look out 3 to 5 years, we look at what are the high cost categories that will continue, especially with increased utilization. The first one is really around specialty drugs in the specifically categories of oncology, immunology, and rare diseases. Second is around complex health conditions, cardiovascular, cancer, autoimmune disorders. And the third is behavioral health trends. This has been an outside driver of trend for some time. We expect it to continue. And when you look at the biggest category within behavioral health, it's autism spectrum disorder, where the prevalence continues to increase. We are building next generation care models that factor in all these different cost levers across the ecosystem to deliver best-in-class performance. Let's take autism as an example. The financial burden of this often overlooked category is staggering. By the end of this year, it's expected autism costs in the US will reach $460 billion. With the continued increase of prevalence of autism, we expect that this could be upwards of $600 billion by 2030. Families who have a child who is getting treated for autism incur 10 times more of the healthcare costs. This is where Aetna comes in. We are building an autism total cost of care model, a first of its kind solution that addresses the co-occurring behavioral health and physical conditions like obesity and sleep disorders. Our solution includes a number of components. First one is an innovative clinical model with a very specific benefit design that supports these kinds of conditions. The second, and this has been mentioned a few times, is the provider partners. High quality providers that have proven outcomes in this space, follow the evidence-based medicine, and are extremely effective in engaging families in the health. A robust advocacy model is a third component of this solution, helping families and these members navigate the healthcare system, again, for all of these co-occurring conditions. And finally, and most importantly, the integration of health services, medical, pharmacy, behavioral health. We're helping families optimize sites of care. We are taking a very complex and highly fragmented experience in the healthcare system. We're simplifying it with a scalable model. This will improve quality. We are aligning incentives across stakeholders. And also, this is going to just create a new type of, a new standard of care for autism as well. This is another area where with families and members, we're going to be building trust at every touch point.